Ladies and gentlemen, thank you for standing by. Welcome to the Public Health and Poison Control Center collaboration following a radiation emergency webinar. During the presentation, all participants will be in a listen-only mode. Afterwards, we will conduct a question-and-answer session. At that time, if you have a question, please press the 1 followed by the 4 on your telephone. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded today, Thursday, February 7th, 2013. I would now like to turn the conference over to Ms. Meredith Allen for ASTHO. Please go ahead.
Hi, everyone. I'd like to welcome you to the webinar on behalf of the National Alliance for Radiation Readiness, also known as the NARR. Before we begin, I'd like to give you a little bit of an introduction to the NARR and some brief information. I'd also like to go over the agenda, and then I will hand it over to our first speaker. The NARR is a coalition of organizations committed to improving the nation's ability to prepare, respond, and recover from radiological emergencies at the local, state, and national level. There are 17 member agencies along with 10 federal partners that participate regularly, and the organization is administered by the Association for State and Territorial Health Officials, also known as ASTHO, with funding and cooperation from the CDC, National Centers for Environmental Health, and the Radiation Studies Branch. Some of our major products and things I'd like to draw your attention to, most of you did register through our clearinghouse website, radiationready.org. This is a forum for sharing resources, tools, and best practices related to radiation planning, response, and recovery. You'll also notice on the clearinghouse that we do have a document that has developed by the NARR that goes through laboratory considerations for prioritization of samples following a radiation event. We also have an after-action report looking at the Fukushima response, the U.S. public health and medical response to domestic concerns. This year, we're currently planning a passenger screening tabletop exercise. We're looking into how to increase collaboration between the radiation control program directors and public health preparedness directors, and we'll also be hosting a few more sessions such as this one that you can find on the NARR Clearinghouse. So today we'll have a presentation first by Dr. Alvin Bronstein looking at the U.S. Poison Center response to the earthquake, to tsunami, and radiation release in Japan, followed by a presentation by Dr. Cantrell on California's poison control system experience and response to the 2011 Japan radiation release. Then we'll have a presentation by Dr. Arthur Chang on the role of poison control centers in radiation emergencies. And finally, we'll have a presentation by Martha Stanbury and Dr. Sharon Watkins on Poison Control Center and public health collaborations at the state level, specifically Michigan and Florida examples. Following each of the presentations, we'll take a few minutes to answer questions, so please use that chat feature that you see on your screens. I'll read your questions aloud to the different presenters for answers, and then we'll also have time at the end to do some more overall questions and things that come up. So, Dr. Bronstein, I'd like to turn it over to you for your presentation.
Well, thank you, Meredith. Thank you very much. Thank you, everyone. I'd like to thank the NARR and ASTHO and the APCC for inviting me to present today and about the Poison Center role in the response to the Japan event. Let me begin that we believe that poison centers are a unique public health response source for the country. They're open 24/7. They're staffed by healthcare professionals, and the poison centers cover all 50 states, 3 Pacific jurisdictions, plus Puerto Rico, the U.S. Virgin Islands. So we cover pretty much the entire U.S. The poison centers have an established relationship with the Centers for Disease Control to collaborate on surveillance of emerging public health events, principally using the National Poison System, called NPDS. The Poison Centers partnered with CDC and other public health entities to assist with a unified public health messaging program and traveler response during the 2011 Japan earthquake and tsunami and radiation release. And this presentation will describe how we develop this organized response. And I'll continue to stress the word organized and consistent messaging because we felt that that was of prime importance because this event in the U.S. and in the entire world was obviously very politically charged. So how we did it. The USPCs were able to craft a stepwise measured response to provide unified messaging both to the PCs and the PC staff and to the public. And we did this in coordination with the public health agencies. One of the first things we did, we realized that the poison centers needed consistent information to provide to the public and to healthcare professionals. And we developed to do this, we developed a series of FAQs about radiation. We obtained the information from the FAQs from a variety of resources, including the CDC, but once we developed the FAQs, we had them vetted by a CDC. This, I believe, was very important because how I might interpret scientific data or the web page from CDC may be totally different than one of my colleagues. So we needed a consistent message for all the poison centers to use. And as it turned out, this was a very good idea because though we talk a lot about response to radiation, very few of us actually have that experience. So we had a complete list of FAQs that were a living document and we could add to them as the situation warranted. To also aid the understanding of poison center staff, we had a series of teleconferences with the poison centers, the CDC, and other experts in radiation that included people from REACS in Oak Ridge, Tennessee. To track the event, we developed a Poisondex product code, which is what all the poison centers use, so that any call that came to a poison center that was related to the event could be uniquely tracked. And this was put in within a day after the event started and was very, very useful for data analysis. We were able to have the Poison Center 800 number, 800-222-1222, and logo added to the radiation page of the CDC. So the public and healthcare professionals would know that the poison centers were a resource for information about the event concerning radiation. The AAPCC Toxicose Surveillance Team, consisting of 10 toxicologists, worked with the poison centers and provided specific case information to CDC about the calls poison centers were receiving. I should also mention that the FAQs were vetted not only by CDC, but vetted by toxicologists from the poison center world, including Dr. Cantrell, who will be speaking later in this presentation. Poison center representatives participated in the nationwide stakeholder call conducted by CDC. And that for the poison center side, that was myself plus Dr. Stu Hurd, who's the director of the California Poison Center system. These calls were very useful to provide information to all of the relevant public health agencies that were responding to the crisis. Also, as part of our collaboration with public health, poison centers were identified as a primary resource for travelers returning from Japan who might have had radiation exposure. And I'll show you some pictures of that in a moment. So the poison centers were intertwined with the response to this event. This is a picture of the web page depicting in the lower right the Poison Center's telephone number and the logo, so that to allow people to know they could access Poison Centers for help with questions about radiation. I think this is very significant as it marks the collaboration between the Poison Centers and the Centers for Disease Control and other public health agencies. And this is just a view, it's too difficult to read, but it shows in the middle the FAQs that we had developed for the Poison Centers, as well as some of the travel documents. And in the travel documents on the left-hand side, the phone number to the Regional Poison Center was listed for individuals to contact if they needed additional help and information. Very detailed flow diagrams were developed by the CDC, and we, of course, worked in consultation with the NCEH at CDC and other CDC groups as these flows were developed to handle traveler management for returning travelers from Japan. The results of the data gathered from calls to Poison Centers during the event showed that the Poison Centers received 300 calls. About 340 of the calls were information calls with questions usually revolving around the effects of radiation or what about the drug potassium iodide. As you all might recall, it was not recommended that individuals in the U.S. should be taking potassium iodide after the event, though many people did attempt to buy it through the internet and other sources and also use the drug. We had 60 exposures that were reported to U.S. Poison Centers. 38 were potassium iodide containing type products, and the other 22 concerned exposure to radiation. And these calls were handled by the Poison Centers and managed by the Poison Centers using the FAQs that we developed for very consistent messaging, so that one of the overarching goals was the consistent messaging, and we were very concerned about not saying anything that would be incorrect nor inflammatory. And I think the use of the FAQs prevented this from occurring. Here is a simple epi chart showing the outbreak, if you will, from the first call that Poison Centers received. This would be all calls on March the 11th, 2011, and then the subsequent increase, and then the steady decline over time. So the calls look like a typical outbreak event. So in conclusion, I'd like to make the following points: that U.S. Poison Centers can quickly mobilize to assist in public health emergencies. The ability to develop structured, vetted FAQs is very important for rare events and also important for events that aren't so rare. So we have unified messaging. The response agencies can benefit from continuous communication with Poison Centers because many times Poison Centers reflect the pulse of the country. So that Poison Centers did play a primary role in this event and were really an integral part of the public health fabric. All of the Poison Center response focused on the timely and accurate delivery of information 24/7 to all callers. We were able to capture the information and the calls in the National Poison Data System, NPDS. and we're able to analyze the information from the National Poison Data System. And the poison centers had continuous communication with the CDC and state and local health agencies. Without this clear planning and organization, the data captured by the poison centers might not have been included in the daily assessments from CDC and other federal and state agencies. This is to be somewhat akin to the work that was done with the Gulf oil spill. And I believe that our rapid, structured effort illustrates the valuable and the efficient role of poison centers in a public health event response. I thank you all very much for your kind attention. Thank you.
Thank you, Dr. Bronstein. This is Meredith from ASTHO. We did have a question from the chat feature. They were wondering if you could provide a little bit more information on how you coordinated with state and local public health agencies in developing and coordinating your messages.
This was done poison center by poison center. The poison centers all have relationships with their local and state health departments. And for instance, here in Denver, as we were part of the response for returning travelers, and we contacted each of the state health departments, speaking with our contacts there, and we also reached out to the radiation health management sections in a preparedness mode to know what to do if we had a returning traveler to one of the states that we serve, what information they would be given, what examinations they might possibly need, and what and anything that would need to be done. This worked out to be this was very well received, so we were prepared should we have a returning traveler with a problem from exposure.
Thank you. We have another question. Can U.S. poison control centers track the use of medical countermeasures during an emergency and include any data on potential adverse effects?
Yes, that's exactly what we did with the potassium iodine calls, where we tracked people who called us who said they had ingested it as a precaution, and we were able to track any adverse events. And I think Dr. Chang will be speaking more in detail about that, about those results. And
as a follow-up, did you experience any barriers or any issues in doing this tracking?
No, there was really no problem doing the tracking. I think that all of the agencies really cooperated. Some agencies took it less, seriously than others, but everyone really worked together, and I think it was important that we were the impetus to push things along.
Great. Thank you, Dr. Bronstein.
Thank you.
And with no further questions, we will move to Dr. Cantrell's presentation.
Hello, everyone. My name is Lee Cantrell, and I'm the director of the San Diego Division of the California Poison Control System. The California Poison Control System is made up of 4 centers distributed throughout the state, and we combine resources, both all electronic resources, to come up with, and we are a centralized single entity poison center, more or less. And I'm pleased with the opportunity to kind of walk through and share our experience with this particular event with you. So on March 11th at approximately 2 p.m. local time, we all know the earthquake occurred. And it's interesting, of note, Fukushima was more than 5,000 miles away from California. The first call to the California Poison Control System occurred March 11, roughly at 2 p.m., 17 hours after the event. and you can see there I cut and pasted the actual question from the caller. Where do you get potassium iodide? Which formulation to get for potential future exposures to radiation? So that occurred late evening, so it was late evening our time on a Thursday, and previous experiences with large-scale disasters or national threats led us to believe that we're probably going to receive a fair number of questions from public callers regarding this event, and so beginning on the evening of Friday the 12th, and then over the weekend, our managerial staff and toxicologists came up with some general information documents to distribute to just our staff locally, including the U.S. Nuclear Regulatory Commission news release, as well as a review of potassium iodide's role in radiation exposure. As a follow-up to in addition, that same day we made sure that everybody had received the APCC coding instructions that Al has previously described during his presentation. It went out earlier than that, but we once again we wanted to emphasize to our staff that this was a very important measure to enable us to capture data regarding this particular exposure or the circumstance. The following day, we distributed specific case coding instructions to our staff, and what I mean by that is we told our staff, based on our particular database that we use, how we wanted cases coded with respect to them either being exposure calls versus information calls, where the calls came from, and trying to elicit our staff to give detailed descriptions of the questions that were asked of us. And then subsequently we asked our staff to go back and retrospectively code all cases that they'd received to date. The same day we issued a press release within California regarding radioactive materials and the relative dangers to our residents. The following day, we were engaged, like Dr. Bronstein has mentioned. Many of our personnel, myself included, assisted in drafting and providing content for the FAQ documents that subsequently, a day or two later, the first draft version was distributed to our staff, and subsequently the second and final draft version was distributed to our staff. And you can see that internally we have an intranet, which is a very valuable source of posting information for all staff all across California. And you can see that within 2 weeks we had every piece of supplemental information available to staff centrally located so that it could be accessed readily and without any problems there. And you can kind of see there's quite a variety of documentation that we came up with some pertaining to travelers returning from Japan, where they could go to get screened, which airports received direct flights from Japan, and similar type of documents. So what was the impact on California poison control system? Well, as you can see there, when you look at the numbers, California, which is other than Hawaii, is probably the closest state to Japan, we ended up receiving half the calls made to all United States poison centers, with a total of 171 total calls received between March and June. And similar to the graph that Dr. Bronstein displayed earlier, the vast majority of those occurred right around the time of the incident, with 80% occurring in March. We had 31 human exposure calls. The vast majority were related to the consumption of iodinated products, either people self-medicating or medicating their children. And then subsequently, they were calling about a risk of adverse reactions. Most of them didn't really make sense, but we nonetheless got called on. We had individuals calling us regarding atmospheric exposures. They were having some subjective symptoms that they felt were absolutely related to radiation fallout from the event, which we, of course, were able to assure them that that was not the case. We also had individuals that had ingested food manufactured in Japan and were concerned that it was at risk for radiation contamination. And we also had a few individuals that were anywhere as close as 20 miles to the reactor when the accident occurred, and they had called us for assistance with respect to what their relative risk of exposure was and if there was any treatment that was needed. So moving on to information calls, we had a large number of drug information calls, and we've already heard some of the types of questions. A lot of them pertain to if individuals should be taking potassium iodide type of products. Just to give you a flavor of some of the calls we received, one person had a previous allergic reaction to an iodinated contrast media and was worried, what would happen if they needed to take some of this and if there was an alternative. And then we also had calls from pregnant women who were concerned that if indeed they were required to take this, was it safe? We also received a numerous amount of calls from healthcare providers, physicians at hospitals wanting to know how they could get a hold of stockpiled medication. We also had calls from pharmacists that wanted to know how to compound, what was the correct formulation for compounding potassium iodide solutions if it came down to a mass, if we had to give large quantities to people. A lot of environmental questions. Are we at risk? How long will it take for the radiation to get here? Questions about, decontamination recommendations for family returning from Japan. Interestingly, we even had a call from a senator's office wondering where to have people go to get tested when they return from Japan. And we were told that they originally had directed this call towards the CDC, which in turn said that the best source of information would be to contact the local poison center. They did that, and they were very pleased in the timely response that we were able to provide. Other interesting questions we received: can my children go out and play outside? Can I take a shower? Is the water contaminated? Should I move to Idaho? Or where can I purchase or get my dosimeter recalibrated? So I just wanted to share a little bit of the broad scale questions that were asked of our staff. And so finally, the impact. So accomplishments. What I think that, the takeaway, I think that one of our primary goals, and I think we achieved this quite well, is we allayed public fear. In addition, we discouraged the unnecessary and potentially dangerous self-treatment. So many people were concerned about the radiation, poisoning risk, and were ready to start taking large volumes of whatever types of available iodine sources they could. We had people that were, perusing the internet and getting kelp-based products because they heard that there was a higher concentration of iodine, and so, it was nice that we had a single uniform line to give them, answer, so we could give them concise information. And in doing so and working with our partners both at the AAPCC level and other federal partners, we provided accurate, up-to-date information as it became available, had a consistent message for all personnel within our system. So as far as the future, we know that disasters are unavoidable, and it's very clear that any disasters, both domestically and internationally, are going to result in phone calls made to poison centers because people look to poison centers as first line of information. One thing I'd like to share is our experience with the anthrax scares that occurred in 2001. The California Poison Control System received almost 600 anthrax-related calls with a very similar distribution that we've seen here with the radiation exposures. And I bring that to attention just because it shows that in the event of where there is the potential for a mass casualty poisoning or exposure situation, people are going to call us, and we are quite often their first line of information. So as far as the future, I think what ways we could potentially improve is come up with an even more rapid coding and information distribution to our staff, and additionally have dedicated information options on our phone tree, because we do have a phone tree, and I think optimizing our use of technology, we could, some of the low-hanging fruit per se, very rudimentary questions, I think callers could very easily be taken care of by utilizing phone tree mechanisms. So with that, I have no additional information for you, and I am welcome to field any questions.
Great. Thank you, Dr. Cantrell. We do have a few questions from the audience. One was, did you collaborate with your 211 center or use any other social media or media outreach in this event?
The only additional media outreach we used was just a general press release, and made that available to all comers. We didn't collaborate with 211. 211 is very regionalized in California, and there's actually only a few counties within California that have a 211 system, so we didn't really engage with them.
Thank you. Another question, can the costs related to the increase in calls to the poison control centers be prohibitive during an emergency?
Well, so far we've been able to ramp up our personnel and response in times of crises, and that's one way, I think, by utilizing technology and developing some plans, preemptively, that we could use poison centers can expand their roles with respect to large-scale response to emergencies.
Great, thank you. Seeing no other questions, thank you, Dr. Cantrell. And Dr. Chang, we'll turn the program over to you.
All right, thank you. Good afternoon or good morning. My name is Art Chang. I'm a medical toxicologist at the Health Studies branch of the CDC. And I was also the epidemiology and surveillance co-lead for the CDC response to the Fukushima radiological incident. For my brief presentation today, I will first describe how CDC used NPDES data for surveillance during the Fukushima response and touch upon briefly other activities that involve poison centers. I will also present some potential future roles based on current poison center capabilities, which will greatly enhance a public health response to a radiological incident in the future. So CDC has used NPDES to provide situational awareness in several public health responses, including the Gulf oil spill, Fukushima, and more recently the fungal meningitis outbreak associated with the epidural medication recall. I'm going to describe that process for you here. So first, after a public health incident is identified, the AAPCC, or American Association of Poison Control Centers, works with individual poison centers to establish an incident-specific code. This is done so that all associated calls to all U.S. poison centers from that point forward will have a label that will allow further characterization of reported exposures or information. During the response, the CDC and AAPCC surveillance teams conduct national surveillance of these label calls. These could be tracking temporal or spatial trends, characterizing specific associated clinical symptoms or outcomes, like mortality, for example, identifying potential new reported cases or clusters, monitoring the perceived risk and communication needs of the public, and also reporting aggregate surveillance data to other public health officials. For the Japan earthquake and radiological incident, we initially used NPDES to track calls involving potential contaminated passengers that were entering the U.S. as part of a traveler screening process. However, as the response progressed, the focus changed and became more about public health messaging particularly the use of potassium iodide by the public. We felt that NPDES was used as a marker for effective communication to the public, along with other social media and internet-based technologies like Facebook and Twitter. We have learned from Chernobyl that there were adverse events related to the unnecessary use of the radiological countermeasure of potassium iodide. We knew that this was potentially going to be an issue after Fukushima nuclear reactor accident as well. We found that NPDES was a great tool to track this on a national scale during our response. By having self-reported poison center call data, we were also able to identify health communication needs, not only about potassium iodide, but also other topics specific to radiation. During the activation of our Emergency Operations Center, NPDES identified a total of 400 calls from all sources, including the public, medical professionals, and other poison center users. The majority, or 85% of these, were information requests from the public, but about 15% of these were reported exposures to either radiation or potassium iodide or other iodides. And obviously, not everyone calls for the poison center, so the true number of inquiries or exposures were likely several times higher than this. Here's a time series graph of the number of calls coming in per day during the CDC response. Notice that there was a spike around March 15th and 17th, which correlated to the increased media coverage of the radiological disaster. As I said before, the trending of these calls were very important to us, especially to the JIC, or Joint Information Center, or the response. For example, if you notice that there was a second peak around March 31st, this actually turned out to be calls related to potassium iodide. This overall trend partly led to our director, Dr. Frieden, to hold a press conference on April 5th in which he told reporters that, quote unquote, there is no reason for anyone in the United States to take potassium iodide at the present time. You can also see that after this press conference, the calls to poison centers about potassium iodide actually had decreased. Here's a breakdown of poison center calls by call subject. One interesting thing to note is how specific the inquiries were from the callers. This was also observed by the Washington State Department of Health from their experience with Fukushima. One lesson that we learned is that the degree of information that was requested from the American public was much more sophisticated than previous nuclear reactor accidents like Chernobyl or 3 Mile Island. This is probably due to the easily accessible information from the internet, social media, radio, and TV. While there were some general calls about radiation, many were very specific, as Dr. Cantrell has already presented, such as what is the indication of dosage of Ki, potassium iodide? What about taking other forms of iodine, like kelp or iodized salt? What do specific levels in rain, water, or milk really mean, and should I worry about that? This emphasizes that we will need public health messages that are clear, understandable, credible, and tiered according to complexity in future radiological emergencies. According to the NPDES data, there were no reported overdosages to Ki and only a few adverse drug reactions like nausea and vomiting during the Fukushima incident here in the U.S. Potassium iodide or Ki is an over-the-counter medication in the U.S. And if you remember, at the time, the public went out and started buying Ki off the shelves. Interestingly, we also found that people were taking iodide supplements instead of Ki, like kelp, iodized salt, and this Mexican herbal medication known as Robano Yodado. These only contain micrograms of iodide, most of these, as compared to the therapeutic dose of potassium iodide, which is either 65 milligrams or 130 milligrams. So this finding was very important in developing public health messages for Fukushima and also future radiological responses in which Ki will truly be needed. As already mentioned before by Dr. Bronstein, the poison centers were also involved in the passenger screening planning and protocol that was instituted at all U.S. airports. If passengers were to be found to have radiological contamination at the airport, they would have been given a pamphlet after they were released that had the poison center number alongside the health department number and the state radiation control number. This was intended so that all passengers would have someone to talk to 24 hours a day and have all their questions answered by the trained specialist. Poison center specialists deal frequently with stressed callers. For example, mothers frantically calling the poison center to ask for advice after their child had just taken the wrong medications, as a concrete example. For this reason, we felt that poison center specialists can not only provide accurate health information, but probably what is the most helpful is to provide reassurance to the caller. Poison center specialists are usually nurses or pharmacists and are also trained to recognize if the caller's symptoms or exposure require an urgent referral to the medical facility. Last summer, we had a roundtable conference here at CDC where we invited 30 poison centers to discuss potential future roles in a radiological emergency. Here are a few potential poison center activities that we discussed. Not only in addition to disseminating one-on-one public health messages to callers, poison centers also have these current capabilities which can also be applied to a radiological response. Poison centers routinely call back persons that have reported an exposure previously to follow up on their recommendations and see how they're doing. The same thing can be done after a radiological exposure, specifically to see if any new symptoms have developed, such as any symptoms that are worrisome for acute radiation sickness, or if they have any other new concerns. Poison centers routinely provide consultation for medication antidotes to medical professionals. For example, physicians consult poison centers often, currently, before the administration of rattlesnake antivenom, cyanide antidote kit, or chelation therapy for metal poisoning, because these medications are very rarely used, and for physicians have not given them before, they may be apprehensive about using them. After a radiological emergency, the use of countermeasures would be no different. And in fact, some of the countermeasures, such as Prussian blue, are already used for other metal toxicities, such as thallium poisoning. So some of the expertise at the medical toxicology level is already there at the poison centers. Finally, poison centers routinely coordinate with medical facilities when they refer a patient to them because they know the capabilities of each local hospital in their coverage area. Again, after a radiological emergency, this will be very important, and poison centers can coordinate with medical facilities by providing telephone triage for callers based on a set criteria that's established at priori, or referring patients to hospitals after they were assessed at alternate care sites like a community reception center. CDC and APC is currently working on a report that will describe these capabilities and will distribute it when finalized in the future. So in summary, poison centers have some very unique capabilities that can greatly improve the effectiveness of a public health response after a radiological emergency. Partnership and collaboration with poison centers can be of great benefit to public health. And those are all the slides that I have. And with that, I'll take any questions. Thank you.
Thank you for your presentation, Dr. Chang. We did have one question about the press releases that were drafted. Are they available as templates for others to utilize in pre-planning?
The press release by Dr. Frieden?
And any of the other documents that were developed?
Yeah, all the documents are on the CDC Radiation Emergencies website. And I was able to find the press releases written up on the Washington Post, I believe. But you know, I can check on that and get back to you.
Great, thank you. There are no other questions. Martha Stanbury, we'll hand over the presentation to you.
Thank you very much. I'm going to be doing this jointly with Sharon Watkins, who is with the Florida Health Department, and we're going to talk about what kinds of things we've done with our poison centers in general, collaboratively, and then specifically that are related to radiation. So in Michigan, we have one large state health department, and we have 45 autonomous local health departments, and one poison center for the state that's located in Detroit with a call volume of about 300 calls a day. And we've been collaborating with the Poison Center since I've been here at the Health Department going back to 2002 Sometimes we've been able to give them funding and sometimes not, unfortunately. But regardless, they've been terrific partners in all of our emergency preparedness. And the medical director has been on, in fact, on a training that we did for local health departments on radiation, sort of Radiation 101. They have always been available to us in consultations on any kind of chemical exposure concerns. They have their own education of the public and providers that they do. They also report reportable conditions to us, to Michigan Department of Community Health, as if they were a healthcare provider. And we have done some collaborations together on outbreak investigations related to chemicals, quite large ones. And I'm just going to give you an example because these really have helped us build the kind of partnerships that would do us well in case there was a radiation emergency. The first really big one that we were involved in was an outbreak of chemical pneumonitis associated with a spray waterproofing product. And most of the cases were in Michigan, but there were some cases in some of the other states as well. And it was primarily associated with one lot. So not only did we collaborate with the Poison Center in tracking the cases that were getting called in to the Poison Center and also through our other physician reporting networks, collaborated on that, but also on the intervention aspects of it, dealing with Consumer Product Safety Commission and getting the product off the market and all that. And then more recently, there was a large oil spill in Michigan, put over 800,000 gallons of crude oil into one of our rivers, creating extremely noxious odors, and the calls started coming in to the Poison Center about that, and we ended up actually using the Poison Center as our agent of the state to not only track the calls that came in from the public, but also we had healthcare providers. We mandated that they report their patients that were being seen with acute illnesses and injuries related to these, primarily the noxious odors, directly to the Poison Center rather than to us, and track them that way through the database management system, the Toxicol system that they have there. And we wrote a joint report, surveillance report together, and all those kinds of public health collaborations. So when we come to radiation, oops, sorry, right, there we go. We've never had a radiation incident in Michigan, but happily, the Poison Center, their fellows and attendings have all attended the training at Oak Ridge through the REACTS, the Radiation Training Center. The Poison Center maintains a list of the hospital radiation safety officers who would really be very important in any kind of a radiation emergency. Our executive director, medical directors worked with APCC, and we talked about radiation codes to make sure that the tracking of radiation exposures is accurate. And in general, the Poison Center has set up so that workers, their information specialists can work remotely. They have communications equipment, so if ever they were needed a surge capacity or they were unable to even come into the office for, one would not like to imagine for what reasons, but that they can work from home to take the important calls that would come in. So our sort of big way of experiencing radiation collaborations with the Poison Center was in the Fukushima response. And Dr. Chang talked a little bit about the CDC passenger screening protocol that CDC developed. And what we did was we worked with the Poison Center and the people at Detroit Metro Airport. Detroit Metro is, I think, one of 6 airports that have a very a large volume of direct flights from Asia, and in particular from Japan. And so they were going to be really a key point when planes would come in. And we had a big meeting at Detroit Metro that involved the Customs and Border Protection, our Department of Environmental Quality, and I'd like to point out that our Chief Radiation Control program in our state is not in the Health Department. It's in our Environmental Quality. This is true of, I think, maybe at least half the states. So they were a very important player in all of this, but not in the health agency. And also the airport police and fire, who would have to deal with any kind of transporting of of people to hospitals or whatever, the quarantine station that's there, which had a facility with a shower and so forth, and of course the poison center. And there were just lots of issues that we all needed to be in the same room together to understand, things like how Customs and Border Protection, what kind of instrumentation they were using to screen the passengers, and understanding what the levels of concern that were on the CDC protocol, what they all meant, and what things would drive actions. And it was very clearly established that our poison center was the lead medical consultant when the screening found somebody above the CDC's level of concern. They were providing radiation evaluation, treatment, medical consultation to the passengers, and also to the providers of passengers, for passengers who would go see healthcare providers. And also that the poison center would be tracking the calls that came in and acting again as a sort of agent of the state to track any patients that had radiation contamination in their data system, Toxicol. So in the future here, I feel that that we're well prepared with our partnership with Poison Center because of their commitment to public health. We have a good understanding of the roles of the different agencies that would be involved in a radiation response, and in particular, the radiation control program at DEQ. Those people and the poison people had never met each other, so when we were at that meeting at Detroit Metro, people really got to know each other. And the people at the radiation control program in DEQ understood better what the expertise in medical treatment and so forth that the Poison Center has. So we have this history of collaborations and of trust and expertise that should do us well. I'll turn this over to Sharon.
Thank you, Martha. Michigan and Florida have a lot in common in the level of coordination between our public health and poison centers, and so she asked me if I would like to say a few words about our poison center and how we network with them. So Florida has 3 poison centers, one in Jacksonville, Miami, and Tampa. The data, however, is replicated statewide, and real-time data is available to the health department. And cases are obviously then available from all of the centers. It's a large call volume. There are approximately 550 to 600 calls per day, and that may be on the low end of an estimate, most of which, of course, involve human exposure calls. And we have a system where these data are loaded in near real time to the Florida Department of Health through our syndromic surveillance system called Essence. So why would health departments be interested in using poison center data? And for us, it's a number of really important things. For us, it may be the first indication of an incident. Sometimes it helps us in identification of cases following an incident, since we do have real-time access to these case records and notes. It can confirm findings from other data sources, such as our emergency department data. I'm sure you're all in the same boat in that many times we are first alerted to an event, an incident, or exposure by news reports, and then our State Watch office reports also. We use Poison Center data to dig in and confirm and see what we can find out about ground situation awareness. And because we do have access to the more detailed notes in our state, it does provide more information about an exposure and detailed case issues. So in our state, some of the examples of using the Poison Center data from a public health perspective, we use it for case reporting and outbreak monitoring for various chemical poisonings. It's really our prime data source for pesticide poisonings. And I need to point out that we have established protocols, case reporting forms, and how we handle chemical disease surveillance, including how we utilize Poison Center data. It can be an early detection of new drug abuse. It can be an early detection and a way of monitoring post-hurricane for carbon monoxide poisoning. And we do use it in our state as a routine way to pick up exposure cases for carbon monoxide and case identification for follow-back with our county health departments. Like Michigan, we're a central state Department of Health, but we do have 67 county health departments, which are really the feet on the ground and who do the disease investigations. We have used the data for detection of labeling problems, for example, with the new drug Spiriva. And we've had some recalls, large recalls, or contaminated products, one with selenium and the peanut butter recall example. We certainly have looked at the data for chemical incidents as well, large ones, similar to Michigan. So we do a number of ways of how we would look at and detect things. We follow call volume. I think from Dr. Bronstein's earlier first slides, there was a slide that indicated the call volume just after the Japanese event, and that's the kind of thing we also look at in large exposure situations. But we certainly look at clinical effects as well as syndromes. We can look at substance-specific exposures, and those can be chemicals as well as radiation. And we can look at specific substance categories, such as radioisotopes, pesticides, or things such as food poisoning and asthma drugs. We can match what we're looking for by a predetermined case definition. So, for instance, carbon monoxide reporting, but during the hurricane season, which of course is important in Florida, as is many Gulf states. So during an incident, it allows near real-time information during an incident, and it provides very valuable information to the epidemiologist, and we use it to estimate number exposed and look at the preliminary demographics. We look at location of where exposure may be occurring. We look at what types and the range of clinical effects are starting to show up in a real-time situation. And we have used, similar to Michigan, we've used incident information call center during large incidents. So they were our call center during the radiation incident, and although Florida did not have any direct flights coming, so we really didn't have the kinds of incident, the level of event that Michigan did, or certainly the West Coast. We were prepared for that, and they have certainly provided call volume for us during the fungal meningitis outbreak. So what makes, I mean, we have also not had a radiation event, so we've not, I can't report on that kind of interaction, but I think why Florida is on the call is that we are confident that we would have a very good experience because we have a very ongoing relationship with our poison centers. We talk, we call each other, they call us. We do receive real-time data. We know them based on infectious as well as chemical events. I mean, it's not just one program that knows our poison center. And we have made an effort to meet in person. It's a large state with 3 centers, so that's not always easy, but most folks that interact with them have met them, and I've certainly met with them on a number of occasions. We are very familiar with the data. We use it in a number of ways. We've tried novel linking processes to look at things such as even mushroom poisoning, and can we link what we see in our poison centers with our hospital emergency and inpatient records and see what we can find. We're aware of, they're aware of our reporting statutes and guidelines, and we're all aware of the limits of sharing medical information. They're very comfortable calling us and asking questions, and we certainly call them with very specific questions. And I think those are really important. I think we'd like to participate more in real-time exercises with them. Again, I think part of our barriers are that we are such a large state that sometimes that's kind of difficult with the travel involved. And so I think that it's been brought up a couple times what makes for a good partnership, and I think that it's clear that the partnership needs to begin before a radiation event, and you need to be comfortable with each other and each other's data and needs and ways of reaching out and response times prior to an event. And so I know that both Michigan and Florida work with their poison centers on a whole host of issues in a variety of manner. And I think that makes us better prepared to handle these kind of events when they come up, and the trust is there so that when we have questions or they have questions for us or we have needs, we know that there is going to be an open dialogue about what they can do and can't do. And I will say that we do support our poison centers financially through public health preparedness funds, and that certainly has allowed them to also purchase surge capacity equipment and be prepared with IT issues and staffing issues for us, but it's just another layer of communication and dialogue that we use in Florida. And thank you very much for allowing us to talk about our relationship.
Thank you, Martha and Sharon, for that great presentation. I do have a few questions for you from the audience. One question is, has anyone developed a mutual aid or data sharing agreement that could be shared between radiation control programs and poison control centers in Michigan or Florida?
We haven't had a data sharing agreement between the radiation control programs and the poison center, but we certainly have between the Department of Community Health and our poison centers in terms of sharing of health data and dealing with those issues.
And again, we also don't have one between the Radiation Bureau and the poison centers, but we have a number of agreements between the Department of Health and our poison centers that allow us to use real-time data and allow us access to the actual record-level data. And it includes being trained in person in a poison center for part of the training.
Great, thank you. Another question, it looks like maybe to all the presenters. To what extent can poison control centers reverse calls to reach people in an impacted area with messages they may need to know? Does anyone know if the poison control centers have a reverse call function?
In California, we do not.
Okay.
And unfortunately, in Florida, I'm not sure that we do.
And this is Al Bronstein. That would be the same true for Denver and the states that we serve. We do not have that capability at the current time.
Thank you. Seeing no more questions on the chat function. Colin, are there any audio questions?
Thank you. Ladies and gentlemen, if you'd like to register for a question over the phone, please press the 1 followed by the 4 on your telephone keypad. You'll hear a 3-tone prompt which simply acknowledges your request. At that time, your line will be briefly accessed from the conference to obtain basic information. If you'd like to withdraw your registration, noticing your question has been answered, please press the 1 followed by the 3. And also, ladies and gentlemen, if you're using a speakerphone, please lift your handset before entering your request. One moment, please, for our first question. Again, as a reminder, to register for a question via the phone, it's the 1-4 on your telephone keypad. And there appear to be no questions at this time. You may proceed with your presentation or closing remarks.
Great, thank you very much. I would like to say thank you to all of the presenters and also all of the participants today for joining the call and the webinar. If you do have any questions, please don't hesitate to contact the presenters directly, or you can contact me, Meredith Allen, at ASTHO. It's M-Allen, A-L-L-E-N, at ASTHO.org. Also, please make sure you visit the NARR Clearinghouse, which is www.radiationready.org. You can also submit questions or comments there, and we will be posting the audio and the recording of the meeting to that website as well. Thank you all very much for your participation. Have a great afternoon.
Ladies and gentlemen, that does conclude the conference call for today. We thank you all for your participation and ask that you please disconnect your lines. Have a great afternoon.